Well, I'm excited today to have a conversation with an old friend, Dr. Eric Bricker from AZ Healthcare, and wanted to just first of all say thank you for spending some time with us here at the Roundstone Captive Forum and sharing a few back and forth. So, one of the first things I think would be helpful is where do most people have a misunderstanding of where their healthcare dollars are being spent?
Yeah, so it's a great question. The majority of folks at employer-sponsored plans, when they think about where they're spending their money, typically all they're thinking about is like, oh, it's a premium that goes to an insurance company in like a black box. And they're not even necessarily even thinking about the claims. And even if they're self-funded, they might not be thinking about it at the granular claims level. But one of the important truisms in healthcare is that it really follows the 80-20 rule, right? Where 80% of your claims spend is only coming from 20% of your claims. And so it's easy to get overwhelmed to be like, I've got to look at all my claims and I've got millions of claims. And it's really like, no, you don't. You really just have to focus on those 20% of folks that are driving 80% of the cost. And if you address that, then that's really going to help you accomplish what you're trying to do.
One of the things I hear a lot of times is this problem or this challenge is just insurmountable. There's new innovation in healthcare, which is a good thing. There's life-saving drugs and procedures arriving on the marketplace all the day, but they're also extremely, extremely expensive. And so, how can someone kind of balance the idea of innovative care and its cost with managing your plan efficiently?
Yeah, so that's a great point too. There's a lot of like healthcare fatigue, right? It's like,
Yeah.
oh, some folks have just become, I think they used to call it Stockholm syndrome, right? It's like where you start like loving your captors, right? And so here, the important thing is that humans are very social creatures, and so we're like monkey see, monkey do, right? So we love social proof, and that's why it's so important for like Roundstone and myself. Like we're always telling stories of these other employers who've like done it, right? And so a lot of times it actually has to do with their peer group. Like if they're around a bunch of other employers, or if they're around a bunch of other broker consultants who are like all negative about being able to do anything, then it's very disempowering. But if you actually show them stories of other employers and other broker consultants that have actually made this change, then it's like, oh, well, they've done it, so then I can do it. And there's, not to get technical, but there's this thing called the technology adoption life cycle. There was this famous book called Crossing the Chasm by Jeffrey Moore that talked about this, where he said, look, anytime you're making a change, there are these early adopters that just do it because it's cool and they're looking for a strategic change, and that's about 17% of the population. And then there's what's called the early majority, who are the pragmatists. And pragmatists typically don't do anything until they see people who are the early adopters. And it's really them seeing the early adopters that cause them to change. So I really, one of the things that we've talked about at this conference is courage. And so one of the things that I've seen be successful is that courage is contagious. And so when one broker consultant sees another broker consultant doing it, they get the courage. And when one employer sees another employer doing it, they get the courage. And I think it's fantastic when there's organizations like Roundstone, and to the certain extent that I try to help do it, we try to give them that confidence to do that.
That's great. One thing that resonates with me, and it's just kind of just reaffirms the belief. I've been in captive insurance pretty much my whole career, and one of the biggest benefits of captive insurance is the whole peer group, because it creates courage. It allows early adopters to share, and they sit around a table together, and they're like, well, if they're doing it, I think we can do it as well.
100%.
So your new director of HR and your CO says to you, Doctor, we got to fix our health plan, but we can't do it overnight. So you're allowed to make 3 changes. You're allowed to do 3 things in this coming year. What would those 3 things be?
Yeah, so it's a great question, and that's where there is more than one way to skin a cat. So the way that one employer would do it isn't necessarily the way another employer would do it, which is totally fine. At a base level, because we're talking to a lot of small and medium-sized businesses, like you do have to self-fund. And to a certain extent, so much of the fully insured market has moved to level funding that is essentially not enough. It's like halvesies, because one of the pieces of flexibility that is a problem is that typically level funded plans do not give you the opportunity to carve out your PBM. And so that's a huge problem. And so to be actually be self-funded and be able to have the flexibility with your TPA and your network and your PBM to have them separate is super important. So one, you got to self-fund. And then two, it's going to be based upon, okay, what type of geographic distribution do I have to my employees? And typically in America, we've got two types of employers. We got geographically concentrated employers, and then we have folks that are spread out, right? And it might be hospitality or technology, where you might only be 300 employees, but you're in 15 states. And then there's other organizations, manufacturing, construction, municipalities, school systems, where like everybody's in one place. And so to the extent that you're all in one place, then actually being able to have your own on-site, near-site clinic, direct primary care, being able to use non-fee-for-service, subscription-based, free out-of-pocket cost primary care that's paid for by the employer to the plan members is super important. I mean, there are gobs and gobs of companies have put. One of the companies here in Dallas, they're the folks that check with the sensors to see if there's any lines underneath the ground before you dig. It's called Texas 811. Like, they're not huge. They got a clinic, right? So if guys going out checking for lines can benefit from a clinic, chances are your folks can benefit from a clinic too. Okay, now, then you've got your folks that are spread out. Obviously, if you're spread out, you can't really do that. And so that's where it really depends upon having virtual solutions that are effectively tailored to the individuals. Okay, what does that mean? That means that you're going to do persona-based communication of those solutions to the employees. You're going to have maternity solutions that you're going to specifically target folks that are going to be concerned about that because of their age and their gender. Then you're going to target to them. Whereas other issues related to diabetes or arthritis and musculoskeletal pain, that's going to be more your folks in your 40s and 50s. So to be able to have persona-based communication of virtual solutions, I've seen that work in a company that was a logistics warehouse company. Guys driving forklifts, and they were in 5 states, so they couldn't do some sort of on-site clinic, right. But they were actually able to get them to use the virtual solutions, which oftentimes are wonderful, but again, it's in the communication. So anyway, long-winded answer to your question. That's what I would do.
Okay. This is related, and so self-funding is the way to go. But there's different ways to self-fund it. You mentioned level funded, it's kind of halvesies. You also have some of the folks, what always shocks me is some of the larger folks are in these ASO relationships where they have the PBMs owned by the insurance company, the TPAs owned by the insurance company. And is there an effective way to self-fund as opposed to an ineffective way to self-fund?
Yeah, so the short answer is yes. And a lot of it has to do with the advantages that you get from self-funding. Okay, so what are the advantages that you get from self-funding? One is access to your data so that you can actually understand the claims that you're paying out, and because every plan is different, what types of solutions do you need to address for your specific claims profile. There are many self-funded plans through a major carrier ASO that don't get detailed claims data. That essentially is like flying blind. The whole point of being self-funded is so that you're no longer flying blind. So you're not accomplishing one of the main tenets of self-funding. Okay, so that's problem number one. Okay, problem number two is then you would like to have the flexibility in claims adjudication such that if you actually want to audit your claims before they're paid, if you want to have direct contracts with certain vendors or certain provider groups like an ambulatory surgery center, and you want a direct contract for knee replacements at 10 grand a knee replacement as opposed to your carrier network at 45 grand, your ASO claims administration is not going to be able to do that. They'll come back to you and they'll say, no. They say to the largest employers in America, no, we can't do that. And so you want not only the data, but then you also want the flexibility to be able to have different types of programs that can still be adjudicated through that plan. And so those are two of the ways that you can self-fund correctly through a TPA as opposed to incorrectly through an ASO.
So we were talking earlier in the conference, and we shared that, hey, the average employer is spending $17,000, more than $17,000 per employee. We shared, hey, at Roundstone it's $5,000 less across our book of business, and you shared some examples even less than that. Is that possible to save that kind of money, and how? Why?
Yeah, so as a physician, having actually worked in the hospital, the actual care itself, the supplies, the people being paid, keeping the lights on, it's not that expensive. It's not that much money. What makes healthcare expensive, it is marked up over and over and over again. We won't get into it now, there's about 5 middlemen that are marking that up in between. And so what you can do as a self-funded employer who's innovative is you can essentially, this is what we talked about at the conference, is you can essentially break down the healthcare supply chain and rebuild it in a way that's much more, when we talk about cost, I don't talk about cost because we're just trying to save money. I talk about cost because it allows you to lower the out-of-pocket costs for the employees, which then gives them better access to care. And that there are employers who are, frankly, they're taking their savings from being self-funded and they're lowering their deductible. They're providing coverage for the family members. They're lowering the co-insurance because a lot of municipalities, they need police officers, they need firefighters, they need better benefits in order to be able to hire these people. And so as a physician, the inefficiency and the middlemen in the healthcare system are actually hurting patients because it's obstructing their access to care. And so I almost look at myself as like a public health worker, but my venue for public health work is the employers of America.
Well, I think that's a great place to end. Roundstone's mission is quality, affordable healthcare for all, and it much in line with what you're saying. It's a reason why we go to work every day and feel good about that. And in one way, it's a tragedy, this inflated cost, but in another, it gives us something to do and feel good doing it.
That's right. It's just a tremendous opportunity.
Yeah. Well, thank you, Doctor, for spending some time with me. Always enjoyable, and look forward to talking again.
Thank you, Mike.
Yep.